Picture this. You're lying in a gilded bed in the Palace of Versailles, 1715. The silk sheets beneath you are damp with fluids you can't quite identify. Your body feels like it's being torn apart from the inside. Every breath is agony. Your vision blurs as another wave of pain crashes through your abdomen. The physicians surrounding your bed wear long black robes and bird-like masks stuffed with herbs. They've been bleeding you for 3 days straight. Your arms are covered in small cuts from repeated medical procedures. You're the Dauphin of France, heir to the most powerful throne in Europe, and you're dying not from disease but from the cure. The lead physician approaches with a new instrument, a metal device designed to bore into your skull. He explains in Latin that the evil humors causing your illness have risen to your brain. They must be released through trepanation, a procedure to relieve pressure from the skull. You try to protest, but your voice is too weak. You're 15 years old. You should be learning statecraft and dancing at balls. Instead, you're about to have your skull opened by men who believe disease is caused by planetary misalignment. This is medicine fit for royalty in the Age of Enlightenment. And it's about to kill you faster than any plague ever could. The Dauphin's death in 1715 wasn't unique. Across Europe, royal bodies were subjected to medical treatments that would be considered torture by any modern standard. These weren't punishments. They were therapies administered by the most educated physicians of their time. Men who spoke multiple languages, studied at prestigious universities, and were entrusted with the health of God's anointed rulers. Yet their cures killed more royalty than all the assassins and poisoners in European history combined. To understand how medicine became an instrument of accidental torture, we must first understand the theoretical framework that guided these physicians. They operated on principles inherited from ancient Greece and Rome, refined through medieval Islamic scholarship, and crystallized into dogma by European universities. The human body was seen as a vessel containing 4 humors: blood, phlegm, yellow bile, and black bile. Health meant balance. Illness meant excess or deficiency. Treatment meant forcibly restoring equilibrium through methods that seem incomprehensibly brutal today. Royal bodies were considered fundamentally different from common flesh. Blue blood wasn't just a metaphor. Physicians genuinely believed that noble constitutions required more aggressive interventions. If a peasant needed 1 bleeding, a duke needed 3. If a merchant required mild purgatives, a prince demanded violent emetics. The logic was perverse but consistent. Greater souls inhabiting nobler bodies produced more potent humors requiring more extreme measures to correct. This belief system transformed royal sick chambers into theaters of medical horror where the cure was invariably worse than the disease. Let's begin with the Spanish court of the late 17th century, where we find Mariana of Austria, Queen Regent and mother of the catastrophically inbred Charles II. By 1696, Mariana suffered from what modern medicine would recognize as chronic inflammatory disease, possibly rheumatoid arthritis combined with recurring infections. But her physicians diagnosed an excess of cold, wet humors pooling in her joints and organs. The treatment they prescribed reveals the grotesque creativity of pre-modern medicine. First came the bleeding. Not the careful phlebotomy practiced today, but aggressive exsanguination designed to drain the body of corrupted fluids. Physicians opened veins in her arms, legs, and neck simultaneously. They applied leeches to her temples, behind her ears, even to her genitals, believing that blood drawn from different locations carried different humoral properties. Mariana would lose pints of blood in a single session, leaving her so weak she couldn't lift her head from the pillow. But this was only the beginning. Next came the purging. Physicians administered cocktails of mercury, antimony, and crushed beetles designed to violently empty her bowels. The queen spent hours trapped on her close stool, her body convulsing as toxic metals tore through her intestines. The resulting dehydration was seen as therapeutic, proof that corrupt humors were being expelled. When oral purgatives proved insufficient, physicians turned to clysters. These weren't simple enemas but complex concoctions containing everything from holy water to pulverized gemstones, administered through syringes the size of modern fire extinguishers. The vomiting phase followed. Physicians forced Mariana to drink emetics containing ground glass, believing that the irritation would help expel humors from her upper body. She would retch until blood vessels burst in her eyes, until her throat was too raw to swallow, until she collapsed from exhaustion. Servants held her head over golden basins while learned men examined the color and consistency of her vomit, making notes in Latin about the progress of her treatment. But perhaps most horrifying were the attempts to draw out deep-seated humors through the skin. Physicians created artificial wounds called issues, cutting deep gashes in her flesh and inserting foreign objects to keep them open and draining. They might pack these wounds with horsehair, beans, or pellets of gold, anything to maintain constant suppuration. The queen's body became a landscape of weeping sores, each one carefully tended to ensure maximum discharge of theoretical poisons. When conventional treatments failed, physicians turned to more exotic remedies. They covered Mariana in plasters made from pigeon droppings mixed with holy oil. They forced her to consume potions containing powdered Egyptian mummies, believing that the preserved flesh of the ancient dead contained mystical healing properties. They hung bags of sacred relics around her neck and placed consecrated wafers on her wounds. Medicine and magic blurred into a single horrifying practice where faith and pseudoscience justified any intervention. The queen's suffering was compounded by the public nature of royal medicine. Every treatment was witnessed by courtiers, recorded by scribes, and discussed by councils. Her body became state property, its functions matters of political importance. Ambassadors wrote detailed reports about her bowel movements. Foreign courts received updates on her menstrual cycles. The most intimate details of her physical existence were scrutinized and debated by strangers who saw her not as a suffering human, but as a biological machine requiring adjustment. Mariana endured these treatments for months, each day bringing new tortures disguised as therapies. Her physicians, confronted with her declining condition, didn't question their methods. Instead, they intensified them. More bleeding, stronger purges, deeper wounds. They operated on the principle that if a treatment wasn't working, it simply wasn't being applied vigorously enough. The queen's screams echoing through palace corridors were interpreted as signs that the humors were fighting their expulsion, proof that the cure was taking effect. From Spain, we traveled to France and the court of Louis XIV, the Sun King, whose medical history reads like a catalogue of therapeutic atrocities. By 1686, Louis suffered from an anal fistula, a painful condition creating abnormal connections between the rectum and surrounding tissue. Today, this would be treated with antibiotics and minor surgery. In the 17th century, it became the occasion for one of the most horrifying medical procedures ever performed on a living monarch. The king's surgeon, Charles-François Félix, had never performed this operation before. To prepare, he practiced on dozens of peasants suffering from similar conditions. Most died. The survivors were sworn to secrecy about their ordeals. When Félix finally felt ready to operate on the king, he assembled an arsenal of specially crafted instruments that looked more like implements of torture than medical tools. The operation took place in the king's bedchamber at Versailles. Louis was positioned face down on a table, his legs spread and secured. No anesthesia existed beyond a few drops of laudanum, barely enough to dull the edge of agony. Félix began by inserting a curved silver probe into the fistula, exploring its depth and direction. The king's screams could be heard 3 rooms away despite the layers of tapestries hung to muffle sound. Next came the cutting. Félix used a specially designed bisturi, a curved blade that could slice through tissue while cauterizing blood vessels. He made an incision to follow the fistula's path and relieve pressure. Blood poured onto the Turkish carpets. Assistants struggled to maintain pressure while Félix worked, their hands slipping in the gore. The king bit through a leather strap, his body convulsing against the restraints. The procedure lasted over 3 hours. Félix cut and cauterized, probed and scraped, determined to remove every trace of diseased tissue. He packed the wound with lint soaked in egg white and rose oil, then bandaged it with strips of silk. The king had to remain on his stomach for weeks, conducting state business while lying prone, receiving ambassadors while face down on a specially constructed couch. But the surgery was only the beginning of Louis's ordeal. Daily, Félix would return to examine and dress the wound. This involved inserting metal dilators to prevent the tissue from healing too quickly, essentially reopening the surgical site every morning. The king would grip the bedposts while Felix probed the wound, checking for signs of infection or incomplete healing. Fresh bleeding was encouraged, seen as proof that bad humors were still draining. The wound care regime was nightmarish. Twice daily, servants would wash the area with wine heated to near boiling. They applied poultices of bread mold and spider webs, believing these substances prevented putrefaction. When the wound showed signs of proud flesh, excessive granulation tissue, Felix would burn it away with caustic silver nitrate or actual hot irons. The smell of burning flesh became a regular feature of the royal bedchamber. Louis's diet during recovery was based on humoral theory rather than nutritional science. Physicians prescribed a regimen of turtle soup and viper broth, believing that these creatures' supposed longevity would transfer to the king. He was forbidden fruits and vegetables, thought to create gas that might disturb the healing tissue. Instead, he consumed meat jellies and marrow broths, often mixed with powdered pearls and gold leaf. The combination of protein deficiency and mineral toxicity slowed healing and caused additional symptoms that physicians treated with more bleeding and purging. The psychological torture of the experience was amplified by its public nature. The king's anal fistula became the most discussed medical condition in Europe. Courtiers composed songs about it. Ambassadors sent coded dispatches describing the wound's appearance. A cult of sympathy developed where nobles claimed to suffer from similar conditions, some even undergoing unnecessary surgery to demonstrate solidarity with their monarch. The king's anus became quite literally an affair of state. Moving north to Russia, we encounter Peter the Great, whose medical experiences illuminate another dimension of royal therapeutic torture. The Tsar suffered from what modern physicians would diagnose as kidney stones and chronic urinary tract infections. But 18th-century Russian medicine, a volatile mixture of European theory and folk tradition, transformed his treatment into an ordeal that would break lesser men. Peter's physicians began with the standard approaches. Bleeding from the penis using specially designed urethral scarificators. These devices, inserted into the urethra, contained spring-loaded blades that would lacerate the passage from within. The theory held that bleeding directly from the affected organ would draw out the stone-forming humors. Peter would grip his throne while physicians continued treatment despite severe bleeding held by trembling servants. When bleeding failed, they turned to chemical warfare. Peter consumed daily doses of turpentine mixed with juniper oil, designed to dissolve stones from within. The mixture burned through his digestive system, causing violent cramping and bloody urine. Physicians saw these symptoms as encouraging, proof that the medicine was working. They increased the doses until Peter vomited blood, a sign they interpreted as the stones beginning to break apart. The mechanical interventions were worse. Physicians attempted to crush stones using primitive lithotrites, metal instruments inserted through the urethra to grasp and fragment calculi. Without imaging technology, they worked blind, grinding metal against tissue as often as stone. Peter's screams during these procedures became legendary. Guards were posted outside the treatment room with orders to prevent anyone from entering, no matter what they heard. Perhaps most grotesque were the attempts at extraction. Using forceps designed for removing arrows from wounds, physicians would probe Peter's bladder through his urethra, searching for stones to grasp and pull free. The tissue damage was catastrophic. Blood clots would block his urethra, requiring further instrumentation to clear. Infections raged through his urinary system, treated with irrigations of mercury solutions that caused additional chemical burns. Peter's diet during these episodes reflected medical theories about stone formation. Physicians prescribed a regimen of stallion urine mixed with powdered antlers, believing that horses' freedom from kidney stones would transfer to the patient. He consumed teas brewed from crushed beetles and scorpions, thought to break down calcifications. When these failed, physicians tried the opposite approach, forcing him to drink chalk suspensions intended to bind with stone-forming substances. The treatments extended beyond internal medicine. Physicians ordered Peter to sit in baths of near-freezing water filled with pulverized limestone, theorizing that external cold would drive heat from his kidneys. He would remain immersed until hypothermia set in, then be wrapped in sheets soaked in brandy and set briefly on fire, the flash of alcohol flames supposed to shock the stones loose. Servants stood ready with wet blankets to prevent actual immolation. Between acute episodes, Peter endured maintenance treatments designed to prevent stone recurrence, daily enemata with solutions of soap and ox gall, weekly bladder irrigations with silver nitrate, monthly prophylactic bleedings from genital veins. His penis became so scarred from repeated instrumentation that urination required mechanical dilation. Yet physicians persisted, viewing each intervention as necessary prevention against future stones. The psychological impact of these treatments on Peter was profound. He developed an obsession with medical procedures, establishing anatomical theaters where he would personally dissect corpses. He collected preserved specimens of kidney stones, displaying them like trophies of his survival. He forced courtiers to undergo similar treatments for minor complaints, spreading his medical trauma throughout Russian nobility. The Tsar, who modernized Russia, also popularized medical torture as a form of shared cultural experience. But perhaps no royal medical horror surpasses the treatment of Queen Caroline of Ansbach, wife of George II of England. In 1737, Caroline developed what began as an umbilical hernia but progressed to strangulated bowel. Modern surgery could have saved her easily. Georgian medicine transformed her final days into a crescendo of therapeutic brutality that shocked even hardened courtiers. The Queen's physicians began with conventional approaches, binding her abdomen so tightly that breathing became difficult, applying heated metal plates to draw out morbid humors, forcing her to swallow pounds of mercury to weight down the protruding organs. When these measures failed, they proceeded to interventions that defy modern comprehension. Physicians attempted manual reduction of the hernia, using techniques borrowed from veterinary practice. They suspended Caroline upside down from ceiling hooks, theorizing that gravity would pull the displaced organs back into position. While inverted, they massaged her abdomen with increasing violence, trying to force the strangulated bowel through the hernial opening. Caroline's screams were so intense that George II fled the palace, unable to endure the sound of his wife's agony. When inversion failed, physicians tried chemical shock. They forced Caroline to drink a mixture of gunpowder and brandy, then applied heated cups to her abdomen to create a vacuum effect. The combination was meant to create internal pressure that would pop the hernia back into place. Instead, it caused violent muscle spasms that worsened the strangulation. Caroline vomited dark fluids that indicated internal distress. The surgical attempts were even worse. Without anesthesia or antiseptic technique, physicians cut into Caroline's abdomen with instruments sterilized only by passing through candle flames. They probed the hernial sac with metal rods, trying to manipulate the trapped bowel. When they accidentally perforated the intestine, harmful internal material was released during surgery. Rather than recognizing the catastrophe, physicians interpreted the spillage as successful drainage of morbid humors. Caroline's treatment became a spectacle of medical ignorance. Physicians tried everything in their arsenal: blistering agents that raised painful welts across her abdomen, electrical shocks from primitive generators, fumigations with sulfur that nearly asphyxiated her. They even attempted to shrink the hernia by applying leeches directly to the protruding mass, believing that reducing blood flow would cause the tissue to contract. As peritonitis set in, physicians intensified their efforts. They created multiple drainage wounds, cutting into healthy tissue to provide outlets for what they called putrid humors. They irrigated these wounds with boiling wine, causing additional tissue death. They packed her abdomen with herbs soaked in mercury solutions. The Queen's belly became a battlefield where medical theory waged war against human physiology. Caroline's final days were spent in delirium caused by sepsis and mercury poisoning. Physicians interpreted her ravings as signs that the treatments were working, that morbid humors were affecting her brain and needed additional outlets. They shaved her head and applied blistering agents to her scalp. They cut behind her ears to insert setons. They even discussed trepanation, but decided the Queen was too weak to survive skull surgery. The Queen died after 11 days of continuous medical torture. Her autopsy revealed what modern physicians immediately recognized as a straightforward strangulated hernia with subsequent peritonitis. Had she received no treatment at all, she might have lived longer and suffered less. Instead, the finest medical minds in England had tortured her to death with interventions that violated every principle of actual healing. These individual stories illuminate a broader pattern of medical practice that viewed royal bodies as experimental subjects for theoretical medicine. The very wealth and power that should have protected monarchs instead made them targets for the most aggressive and dangerous treatments available. Every royal illness became an opportunity for physicians to demonstrate their learning, to try new theories, to push the boundaries of intervention. The economic incentives were perverse. Royal physicians were paid not for successful outcomes but for the complexity and intensity of their treatments. A simple cure brought little reward. An elaborate regimen of bleeding, purging, and exotic remedies could secure a physician's fortune. This created a medical arms race where doctors competed to prescribe ever more extreme interventions, each trying to prove their superior dedication to the royal patient. The intellectual framework supporting these treatments was remarkably resistant to empirical evidence. When patients died, physicians blamed insufficient application of treatment rather than the treatment itself. When patients survived despite treatment, physicians credited their interventions rather than natural healing. This confirmation bias created a self-reinforcing system where therapeutic failure led to therapeutic intensification. The social dynamics of court medicine amplified these problems. Royal physicians operated in environments where questioning authority was dangerous. A doctor who suggested that bleeding might be harmful risked not just his position, but potentially his life. Courtiers who benefited from a monarch's illness had no incentive to promote effective treatment. Foreign ambassadors sometimes bribed physicians to ensure that enemy monarchs received the most aggressive and damaging therapies possible. The religious dimension added another layer of complexity. Many treatments incorporated spiritual elements that made them impossible to refuse without appearing impious. Holy relics applied to wounds, consecrated oils mixed with medicines, prayers recited during surgical procedures. To reject these treatments was to reject God's healing power, a form of blasphemy that few monarchs dared commit. The gendered nature of royal medicine created special horrors for queens and princesses. Female bodies were considered inherently unbalanced, requiring more aggressive intervention to maintain health. Gynecological complaints were treated with spectacular brutality. Hot irons applied to genitals to cauterize supposed ulcers. Mercury douches for vaginal discharge. Surgical removal of the clitoris for excessive sexual desire. These treatments were performed without anesthesia by male physicians who viewed female anatomy as inherently pathological. The treatment of royal children was particularly horrifying. Young princes and princesses endured adult-sized doses of toxic medicines. Their small bodies were subjected to bleeding and purging that left them permanently weakened. The Dauphin of France, son of Louis XV, was bled daily from age 5 to prevent future illness. By adolescence, he was so anemic that he could barely stand. Physicians interpreted his weakness as evidence of particularly stubborn humors requiring even more aggressive treatment. Royal pregnancies became medical nightmares. Queens were bled throughout gestation to prevent the buildup of excess blood. They were purged monthly to ensure the womb remained clean. During labor, physicians employed instruments of terrifying creativity: hooks to extract retained placentas, perforators to collapse fetal skulls, symphysiotomy saws to cut through pelvic bones. The childbed became a torture chamber where medical theory justified any intervention to preserve royal bloodlines. Mental illness among royalty received treatments that anticipated the worst excesses of later asylum medicine. George III's madness was treated with restraint chairs, ice baths, and blistering agents applied to shaved scalps. He was gagged to prevent raving and blindfolded to reduce stimulation. Physicians beat him with rods to shock him back to sanity. They force-fed him mercury until his teeth fell out. They applied heated glass cups to his head to draw mad humors from his brain. The cosmetic treatments demanded by royal vanity added another dimension of medical horror. Queens subjected themselves to facial treatments using lead, white, and mercury compounds that slowly poisoned them. They used belladonna drops to dilate pupils, causing vision damage. They consumed arsenic wafers to achieve fashionable pallor. The pursuit of royal beauty became a slow suicide by toxic cosmetics. Even death didn't end royal medical torture. Royal bodies were subjected to elaborate embalming procedures that would horrify modern morticians. Organs were removed and replaced with sawdust soaked in mercury. Bodies were drained of blood and refilled with wine and spices. Brains were extracted through the nose and replaced with frankincense. These procedures were performed in full view of courtiers who were required to witness the transformation of royal flesh into preserved relics. The legacy of these medical horrors extended beyond individual suffering. Royal treatments set standards that trickled down through society. If the king endured extreme bleeding, nobles felt obligated to demand similar treatment. If the queen survived mercury purges, court ladies subjected themselves to the same ordeal. Royal medicine became a template for therapeutic violence that spread throughout European society. Yet within this catalogue of medical horror, we can glimpse the seeds of modern medicine's birth. Each therapeutic failure contributed data that eventually led to better understanding. The spectacular deaths of monarchs from bloodletting helped demonstrate the vital importance of blood volume. The agony of surgical patients drove the search for anesthetics. The failure of humoral theory opened space for germ theory and scientific medicine. The physicians who tortured royalty weren't sadists. They were educated men operating within theoretical frameworks that made sense given their limited understanding. They genuinely believed they were helping. Their failure wasn't moral, but epistemological. They lacked the tools to test their theories against reality. They worked in social systems that rewarded confidence over curiosity, tradition over innovation. This history matters because medical authority still demands trust that can be misplaced. Modern medicine has abandoned humoral theory and embraced evidence-based practice, but the social dynamics that allowed theoretical treatments to torture patients persist in different forms. When we grant healers power over bodies, we create possibilities for both healing and harm. The difference lies in our willingness to question, to demand evidence, to remember that medical authority must be earned through results rather than assumed through tradition. The royal bodies subjected to these treatments paid an enormous price for medical progress. Their suffering contributed to the eventual abandonment of harmful practices. Their deaths demonstrated the importance of empirical observation over theoretical elegance. They were unwilling martyrs to medical science, their agonies teaching future generations what not to do. Today, we look back at these treatments with horror and disbelief. How could educated people inflict such suffering in the name of healing? How could patients endure such torture in hope of cure? But perhaps future generations will ask similar questions about our own medical practices. What barbarisms do we accept because they align with current theory? What suffering do we inflict because we lack better alternatives? The lesson isn't that medicine is inherently cruel, but that medical practice divorced from empirical validation becomes indistinguishable from torture. The royal patients who suffered these grotesque treatments remind us that good intentions without good evidence can kill. That theoretical elegance without practical results is worthless. That the vulnerability of patients creates obligations for practitioners that transcend social hierarchy or intellectual tradition. In the end, these stories of royal medical horror serve as cautionary tales about the dangers of unchecked authority, unquestioned tradition, and untested theory. They remind us that progress in medicine, as in all human endeavors, requires the courage to acknowledge failure, the humility to question established practice, and the compassion to prioritize patient welfare over theoretical purity. The monarchs who died in agony from their treatments deserved better. Their suffering demands that we do better. Their legacy lives on not in the treatments that killed them, but in the lessons their deaths taught about the vital importance of evidence-based medicine. History's most refined halls once echoed with suffering disguised as healing. And that legacy still warns us. Unchecked power can turn medicine into its opposite.